Hi, welcome to my platform. My name is Dr. Karen. This is an All Things Health platform, and today we are going to talk about coronavirus, the infamous COVID-19. So, last year, December, Dr. Li Wenliang, a Chinese doctor, informed some of his colleagues of a possible outbreak of a SARS-like respiratory infection, but he was arrested by the Chinese government, insinuating that he was spreading false information. He was, however, released a few days later, and while he was attending one of his patients, he contracted the virus and he succumbed to it. According to some people, Dr. Li is considered a whistleblower, but to the Chinese, he is a hero. So coronaviruses have been here. They have been here for the longest time possible. For instance, the coronavirus was responsible for the SARS outbreak in the year 2002, which claimed approximately 724 individuals. It was also responsible for the MERS, the Middle Eastern Respiratory Syndrome, which claimed another 400 individuals. And now the COVID-19, which is a strain of coronavirus caused by the SARS-CoV-2, which has claimed a lot of lives, currently at around 14,703 individuals worldwide. So this virus is transmitted via aerosols. Majorly it's airborne. When someone coughs, when they sneeze, when they talk. It's also transmitted via contacts. This virus can fall into several surfaces, and when an individual touches them, they can contract the virus from that particular surface. This virus is stable depending on the surface in which it is. When it's in air, it can last for up to 8 hours, but can vary depending on the atmospheric conditions. When it falls on a copper surface, it can last for up to 4 hours. When it falls on plastic or stainless steel, it can last up to 2 to 3 days. Now, we also know that prevention is better than cure, and this is why I'm going to emphasize on the preventive measures that our governments have put in place in order to counter the transmission of this disease. So one is washing our hands. Wash your hands with soap and water for at least 20 seconds. I know most people will find it hard to time 20 seconds, but there are certain organizations that have proposed that when you're washing your hands, you can sing the happy birthday song twice, and that will amount to about 2 seconds. Another preventive measure, we can sanitize our hands with hand sanitizer containing at least 60% of alcohol. Then in case an individual is coughing, you can cough to a tissue paper, you can cough to a handkerchief, but the most preferred is using a disposable tissue. But if you cannot, you can use a handkerchief. If you cannot use both, then you can cough to your elbow like this. Then another measure is avoid touching your face, especially your eyes, your nose and your mouth with your hands, because there is a possibility that you might have touched a surface that was contaminated. Or if you cough to your bare hands, there are possibilities that you might touch other surfaces or greet people, and eventually you may end up transmitting the virus. Another measure is avoiding crowded places. At this scenario, we don't know who has the virus and who doesn't have the virus. And a study has it that 1 in 4 individuals with coronavirus are asymptomatic. So you don't know who has it, you don't know who doesn't have it. So it's paramount that we avoid crowded places, because when there are many of you in a space, Someone might talk, someone might cough, and you might eventually end up contracting the virus. So, how does this COVID-19 present? There are cardinal symptoms: fever, dry cough, and difficulty in breathing. Though there are other symptoms such as fatigue, you feel like your body is aching. Others can present with shortness of breath, others can present with diarrhea, abdominal pains. So, and majority of patients with this disease are asymptomatic. So, if you have history of travel to regions with this COVID-19, it does not mean that if you lack the symptoms, you do not have the disease. So currently, there is no definitive treatment for COVID-19. You cannot say this is the first line treatment for COVID-19. There is no, but we are currently just using supportive measures. Currently, the researchers are using a combination of chloroquine phosphate with azithromycin, though it has shown that it has cardiovascular side effects, prolongation of the QRS interval. There are also other antiretrovirals that researchers are advising to be used, but they have not been proven that they really cure the disease. Good news, however, is that there is research is underway to produce a vaccine that can be used in preventing this COVID-19. And 1 week ago, the first clinical trial was begun, and the first individual was injected with the vaccine, and we are hopeful that it is going to work. And if it works, then there is hope for humanity. And I must say that this is the first time in the history of humanity that the whole world is in lockdown. It means that we are really, really living in borrowed time, and we must be cautious. We be cautious about ourselves, we be cautious about our neighbors, and let's follow all the preventive measures that have been put in place by our government. And the mortality of this disease varies from one age group to another, and children specifically have, as at now, have a mortality rate of 0. There are no reported cases of children dying from COVID-19. They, however, can get infected and they can be asymptomatic but can still transmit the infection to other people of other age groups. This disease has a poorer prognosis in elderly individuals with comorbidities such as diabetes, hypertension, and pre-existing respiratory infections such as pneumonia, asthma, and chronic obstructive pulmonary disease. This disease presents with various severities, as I said, varying with age, and up to 70% of cases are mild, and only a small percentage presents with severe infection. So as at now, the cases of COVID-19 worldwide stands as at 23rd March 2020. The worldwide cases of COVID-19 stands at 333,619. The deaths are 14,704, and individuals that have recovered are 99,014 worldwide. And out of the 14,703 deaths that I had earlier mentioned, 900 are from Africa. That's the end of today's video. Until next time, bye.